There's a crisis in our lives right now. Publicly, few want to talk about it. Privately, it's what everyone is discussing.
Rich, poor, urban, rural, honor students, cancer patients, injured athletes, many who never saw it coming.
Opioids don't discriminate. America's addiction is everywhere, and tonight we want to bring the conversation out of the shadows.
We want to address this issue head on and ask, why can't anyone find a solution?
More people died in 2016 from overdose than the sum total of all the Americans who died in the 20 years of the Vietnam War. That is startling.
Americans dropping dead every day from opioid overdose. Tonight, a local researcher finds addicts see their future differently than the normal person. Plus,
sometimes you feel a little guilt at times that I should have recognized the problem.
Doctors get honest about their role in the opioid epidemic, as they recall being penalized for not making patients 100% pain-free. And
to just throw out narcotics and opiates just so you can play a game, I think is inappropriate.
Athlete to addict. As the number of painkiller prescriptions rises due to sports injuries, one NFL Hall of Famer is raising awareness of the risk of addiction among young players and their parents.
This is a WSLS 10 special presentation, Opioid Nation, an American Epidemic, in community partnership with Carilion Clinic.
Good evening and thanks for joining us. I'm Lindsay Ward.
I'm John Carlin. As we dig deeper into the opioid crisis, we also want to help those impacted.
Throughout our hour-long special, assessment specialists from Carilion Connect are on hand to answer your calls and assist you in getting you the help you or a loved one needs.
WSLS 10's Rachel Lucas is standing by live tonight in our phone bank, and she joins us now. Rachel, really, this is just the first step to recovery, isn't it?
John, Lindsay, tonight really is about starting a conversation with the community, breaking the stigma and creating a safe place for families to start having these discussions about such a really important topic that is affecting our community. Now, I'm here in our phone bank, standing behind me, waiting to take your calls now as our phone banks are open, is Carilion Connect. They are trained professionals who are here ready to take your calls. If you may be struggling tonight with addiction, have a loved one who is struggling with addiction, they're the people who can call, put you in touch with them to get anything that you need. Now, I want to introduce you to a very important person tonight, Deirdre Ray. Thank you so much. She's with Carilion Connect. Who should call tonight and why?
Anyone can call tonight. I think one of the things that's most important is that addiction involves families, involves relationships, involves all kinds of people. And so it touches everyone, and so everyone really is entitled to call to find out information, not only to help the person that may be addicted, if you're not the person that's addicted yourself, but also to find out for yourselves, how do you cope with helping that person in order to get the treatment that they need to get. So really this is for anyone to be able to call, because everyone is affected by addiction. We see people that struggle with this really from the ages of 11, 12 years old all the way into the 80s and beyond. It doesn't discriminate. It hits everyone. And so as a result, everybody should really consider calling.
All right, thank you so much. Thank you all for being here tonight. They are standing by, ready to take your phone calls. We had a lot of people call in earlier today for our phone bank. We want you to know you're not alone, that you do have resources here. I'll check back with you in just a little bit. John and Lindsay.
All right, thank you, Rachel. So the big question is, how did we get to this point? Recently, the Trump administration declared the opioid epidemic a national emergency.
But the experts say the problem started years ago with the increase in painkiller prescriptions. An addiction researcher at Virginia Tech says the problem intensified after the 2008 recession. Many looked to the pills to take the edge off. He went on to say that users turned to heroin, and now dealers are lacing heroin with the deadly drug fentanyl, and he says there's no quick fix.
Doing a lot of small, a lot of things that collectively are going to add up to change this problem, right? I don't think I don't think there's a magic bullet. There's never been a magic bullet. So we have to get organized and reorient ourselves to the current circumstances.
And for the next hour, that's exactly what we're going to do. Look at the current circumstances of this nationwide problem. Going back to what the researcher says is the starting line. In the early 1990s, the number of painkiller prescriptions filled at U.S. pharmacies increased by 2 to 3 million each year.
Yeah, by 1996, that number had jumped by 8 million. Reporter Melanie Lawson tonight explains how doctors say they quickly became a part of the painkiller problem.
There's no question that our best, strongest pain medicines are the opioids.
North Carolina doctor Alan Spanos made a convincing statement back in 1998.
They don't wear out, they go on working. They do not have serious medical side effects.
It sold doctors, finally, an answer to help patients get rid of pain.
And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Around the same time, pain was put on equal status with blood pressure, heart rate, and temperature when measuring a person's health.
Physicians were actually penalized for not making patients 100% pain-free.
At the time, Dr. Parveen Khanna was a medical student. She now owns Pain Medicine Physicians of Jacksonville, but remembers the pressure to prescribe.
Patient became the judge. If you don't prescribe them or treat their pain the way they want to, you get bad reviews.
Dr. Sunil Joshi, the president of the Duval County Medical Society Foundation, says it wasn't just the marketing, but major studies that refuted what doctors had always known about opioids. They are addictive.
So then you start looking at all that and you feel that the drug is not habit-forming or addictive, so you feel like it's okay to prescribe it.
Did that lead to these 90-day prescriptions and 30-day prescriptions for acute pain?
Oh, absolutely. And so, again, patients who had pain felt like they were doing better on these medications, and so suddenly this was the way to do it.
During this time, prescriptions exploded, going up 8 million in 1 year.
Patients were not thinking that it could be harmful to them. They were just trying to take care of the pain and make it zero.
At what point is it the doctor's responsibility to say, hey, there's a problem here. This is no longer being used for pain, but this person has an addiction?
Yeah, and I think that without question, we have to take some responsibility here because these medicines are coming by prescription, and we have to realize at some point that we're only treating pain for these patients and that we should only be treating it for brief periods of time.
In 2014, the guidelines from the American College of Physicians changed. It's now recommended that patients should physically see the doctor to get a refill instead of just calling the office. Doctors are also encouraged to address acute pain with shorter prescriptions and no refills.
You really need to be a little bit of an investigator, but also you do need to take patients at their word.
Dr. Justin Spooner of Beaches Laser Spine and Pain is also a psychiatrist. He believes doctors have the responsibility to be a part of the solution, and that means being proactive.
And that's, again, where it comes down to physician training and education. Many physicians are well-meaning. We have a medication that makes you feel good. Why not give you more? And doctors are aware of the risks.
When prescribing opioids, Dr. Khanna uses a checklist to determine a person's risk for addiction. She also has them answer questions to rate their sleepiness and sign an agreement that they won't share or abuse these drugs. She says the responsibility falls on her to consider all of this when prescribing opioids.
How does that feel, as the doctor who really wants to cause no harm, and now you're in a situation where unknowingly you may have contributed to a death or somebody who has overdosed?
It doesn't feel good. Sometimes you feel a little guilt at times that I should have recognized the problem.
Dr. Joshi says all doctors have to make the tough judgment calls. If not, the results can be deadly.
And the physician needs to go to bed at night feeling like they did what's right for the patient. And ultimately, when physicians are looking at it that way, being altruistic for the patient, they will always do the right thing.
And we know it's a big problem here. In fact, part of our area leads the nation in an alarming statistic. People in Martinsville are prescribed more opioids than anywhere else in the country. And that's according to a recent study by the Centers for Disease Control. WSLS 10's Rachel Lucas spoke to doctors about why that is and tells us what the community is doing about it.
A problem so serious, so prevalent, it means going door to door to every home in Martinsville to talk about the issue.
Give you information about the opioid epidemic that's in our area.
Although Martinsville is home to fewer than 13,500 people, they on average are taking more doctor-prescribed opioids than any other place in the country.
We're #1 in the nation, and we're working on that.
According to the CDC, clinicians there prescribed almost 4,090 morphine milligram equivalents per person in the year 2015. And to put that into perspective, the national average was only 640 milligram equivalents per person.
We've had problems in our community in that our rates of likely opioid addiction, as well as opioid overdose and opioid deaths, are higher than what we would like to see anywhere, but higher than the rates around the country.
Martinsville Memorial Hospital announced it had seen a 40% increase in emergency room visits due to opioid overdoses last year. Why Martinsville? Dr. Mark Greenewald with Carilion says it could be in part work-related.
That is a population that has a lot of occupational injuries because of the kind of work that's been done there historically. And so if you look at that whole map, there's a lot of folks who have made their living through physical labor. With that comes a lot of injuries, with that comes a lot of chronic musculoskeletal problems, and so you can start to see why perhaps those particular patients were started on these kinds of pain medicines in the first place.
While the labor industry was booming in Martinsville, opioids were still being pushed by the National Medical Association as a non-addictive form of treatment.
I don't think we anticipated this when we started using these medications years ago to control pain, is that within 3 to 7 days, an individual can be addicted to an opioid.
But now that doctors know, where are all these prescriptions coming from? We asked health leaders at Sova Health in Martinsville and at Carilion, both leaders in the industry and the area, who not only began addressing the issue years ago by limiting prescriptions, but whose numbers show it's not their doctors.
Quite frankly, we've been maybe a little bit ahead. We've been working on this through our emergency room for over a year now, changing the way prescription medication, particularly opioids or pain medication, are prescribed through our emergency rooms.
It was very surprising for us because we do know our data for our Martinsville practice, the Carilion Martinsville practice, and that data is not out of the ordinary with the rest of our practices. And so, again, the way I interpreted that was, I don't know who's doing that, but it's not our practices.
Now under investigation by the DEA, a Martinsville doctor of osteopathic medicine, Dr. Joel Smithers, who operated the Center for Integrative Health at Smithers Community Healthcare, was recently arrested and charged by federal authorities with illegal possession with the intent to distribute Schedule II drugs. While awaiting a trial, this licensed doctor is no longer allowed to prescribe. Although he works in Martinsville, he's from North Carolina. Police tell us that state line is a big part of the problem, even skewing Martinsville's numbers as North Carolina residents come here to fill their prescriptions and vice versa, untraceable so that they can doctor shop in 2 states.
Physicians are realizing that we are part of the solution.
The Virginia Board of Medicine now has new laws limiting the amount of opioids doctors can prescribe, and in most states it's monitored.
The prescription monitoring program basically allows us to see all the controlled substance prescriptions that have been written for a patient. We can do that, and we have what are called reciprocal agreements with 22 states around the country, including West Virginia, including Kentucky, including Tennessee, including Maryland. But right now, as of 2017, we don't have that with North Carolina.
A loophole that allows those addicted to opioids to fill prescriptions in 2 states without being caught by police or even doctors.
Doing information about the legal prescriptions or opioid problem.
Face to face, the medical community is now working alongside police and community organizations to reverse the effects.
We're just trying to get a foothold here to make people more aware of it, and education is the key.
Between 60 and 200 homes are visited by volunteers every Saturday to talk about the dangers of opioids.
Overdoses, whether intentional or accidental, the medications fall into children's hands. The people might not be aware of what they actually are prescribed to take, not aware it's opioid medication.
We have to educate the young not to use, and we have to educate maybe the older, elderly, maybe the grandparents that don't realize that having their prescriptions available in the prescription cabinet can be an invitation for someone to take a few.
Community efforts Martinsville is taking in the right direction, although they know it's going to be a long road ahead.
And speaking of the youth, young athletes are at a higher risk of becoming addicts.
And that's why NFL Hall of Famer Jerome Bettis is taking the time to talk to young football players about drug abuse, specifically opioid addiction. Reporter James Edmonds has the story for us tonight.
When Jerome Bettis comes to town, crowds gather. His star certainly shines bright in his hometown of Detroit, which is precisely why he's here.
I was sitting just like you, listening to guys come up and talk.
The bus may be on a football field surrounded by teen players, but the discussion today is not about X's and O's. Instead, it's about drug abuse, specifically opioid addiction.
It's in the community, but it's in all of our communities. And I think that's the important part. You know, yes, it's a national issue, but it's also a local issue. And it's our issue. And if we don't deal with that issue, it's going to affect more and more of our children.
With sports come injuries. Athletes have the added pressure of returning to the field.
To me, we got to look at the future and tomorrow, and to just throw out narcotics and opiates just so you can play a game, I think is inappropriate.
Dr. Anthony Colucci is the medical director at Henry Ford Macomb. He is also the team doctor for the Detroit Red Wings. He says the use of opioids should only be prescribed for 48 hours post-surgery.
The doctors started this whole problem as they were given 60 tablets, a week's worth, 2 weeks worth, unlimited use. They get dependent on it without an education piece, and then this receptor needs it.
Back in 2013, University of Michigan's Philip Valise did a 3-year study of 743 male and 751 female adolescents in southeast Michigan. He found male adolescent athletes who participated in competitive sports had 2 times greater odds of being prescribed painkillers and had 4 times greater odds of medically misusing painkillers.
And I found that certain sports, more likely high contact sports, those athletes were more likely to misuse opioids. And also there's the culture around high contact sports as playing through pain. And you know, athletes are going to be more likely to fight through that, or they might want to mask it with some sort of drug so they can get back on the playing field as soon as possible.
By the time high school athletes become seniors, approximately 11% will have used a narcotic pain reliever such as OxyContin or Vicodin for non-medical purposes.
We can't say that simply because they're misusing them, they're going to become addicted. However, they're increasing the risk.
On the professional level, Dr. Colucci takes care not to prescribe his athletes narcotics if he can help it.
The goal is to get them back out onto the playing field or playing surface as soon as possible. You can't be snowing them with opiates and narcotics, but you may use the first day or two depending on their injury, but they don't want anything to do with it, at least the ones that I'm affiliated with, and we don't promote it, we don't push it.
As for Bettis, he says he's never dealt with an addiction to opioids personally. He was lucky to not sustain a serious injury in his football career, but he's seen other NFL players struggle.
But there were some horror stories about guys that abused the pain medication, and it didn't start big, it started small, and it started because of an injury, but then after that injury was healed, you still saw that those issues linger.
Eventually, prescriptions expire, but the addiction remains, and the jump to heroin is an easy one. According to a Sports Illustrated article from 2015 entitled "How Pain Medications Are Turning Young Athletes into Heroin Addicts," 80% of all users arrive at heroin after abusing opioid painkillers such as OxyContin, Percocet, and Vicodin. That is a scary stat, and once a person has become addicted to heroin, it's hard to bring them back, if at all.
I call it the pool of addiction. How do we get them out of that pool? I mean, they're swimming around, throw them a life preserver. We help with pain specialists, behavioral addictionologists, and it's pretty challenging.
It's an epidemic that starts small, oftentimes for an athlete with an injury on the field. So what's the answer? Dr. Colucci says education.
The biggest thing is we as clinicians have to be responsible with education and the prescribing practices, but also I think there's a point where the players have to take a responsibility, the parents have to take a responsibility. Don't just bury your head in the sand.
Enter big star athletes like the bus, who's driving the message home right to those who look up to him.
So as you heard, sports injuries can often be the beginning of opioid addictions.
As teens recover from surgeries or other procedures related to those injuries, they're often prescribed opioids for pain.
So now we want to check back in with Rachel, who is live in our phone bank tonight. So Rachel, this is a resource that concerned parents should call tonight to talk to experts about, to start conversations with their teens and also with their doctors.
John and Lindsay, health experts that I spoke to, tell me that an addiction can form to opioids within day 3 and day 7 of taking them. And of course, that includes teens. And it's important to keep that in mind when talking about opioids, or maybe if you're a parent, your child may have had a sports injury or some type of surgery and they've been prescribed these. It's important to start those conversations with doctors now to really monitor that whole progress. And that's what tonight is all about, raising awareness about this. And if you have those questions, if you have those concerns, you can call here into our phone bank. Since our special kicked off at 10 o'clock tonight, our phones have been ringing. As you can see, our friends here from Carilion Connect have been answering questions from concerned viewers, and that's what we hope, that you will take an opportunity to call in. Now, you'll see the number for our phone bank on the screen. It's 540-512-1620. This resource will be going on through 11 o'clock tonight, and I'll check back in with you in just a little bit. But for now, live in our phone bank, I'm Rachel Lucas, WSLS 10.
Well, fighting the opioid epidemic is a constant battle, and no one knows that better than the men and women in uniform who respond daily. But as reporter Kristen O'Connor explains, not everyone on the front lines needs a badge.
Hi, sweetheart. Hi, darling. Hi, precious.
For Pat Jordan, cuddling isn't just an act of kindness.
You just let him know it's going to be okay.
It's a calling. Pat has 6 grandchildren and 9 great-grandchildren, but the babies most people see in her arms aren't hers.
It's very emotional, and I cry a lot up here.
She says she cries because these babies inside the neonatal intensive care unit at Winnie Palmer Hospital are born with a condition the otherwise healthy newborns never had the chance to fight, caused by opioid addiction. Dr. Douglas Hardy treats about 150 babies a year born with neonatal abstinence syndrome.
Whether it's heroin, whether it's some of the other opioid drugs, the mom's system absorbs the opioids and then it gets into the babies, and the babies then have to go through what's very similar to a withdrawal.
Oftentimes, NICU volunteers spend the first critical hours of the infant's life keeping them calm, while their mothers can't be there.
It's very, very difficult because, are very hard to take care of because they're extremely needy, and we just try to hold them tight and cuddle them and let them try to get over it.
They're very irritable, they're very uncomfortable, they don't socialize well, they don't like loud music, they don't like bright lights. Just being held by a volunteer is a tremendous improvement. It keeps the babies calm. If we can keep the babies calm, then we don't have to use drugs.
Jennifer Patterson has been working with families dealing with drug abuse for nearly 2 decades.
We have a lot of newborns who are born addicted and have to go through those withdrawals.
In some places, they may be occupying 40% of the NICU beds.
But it's not just the babies that addiction has a devastating effect on.
A lot of our parents have a lot of children. They may have 2 or 3, and the siblings could be older. And so it's affected them in school. I mean, it affects the families because of homelessness. They tend to be a little bit more transient because, the parents are struggling to maintain employment. It's a ripple effect through the whole family.
Children sometimes do have to be removed from their parents, and they do need a safe place to stay while the parents overcome their addiction.
The most recent data from the U.S. Department of Health and Human Services show as the opioid crisis gets worse, more and more kids are being placed in foster care. Nationally, the numbers jumped 8% between 2012 and 2015. Generations United estimates more than 2.5 million children now live with relatives or family friends instead of their parents. Substance abuse was the reason for the removal of more than 32% of children in 2015. And experts say that number could be underestimating the problem, depending on how local officials fill out forms. While children are separated from their parents, case managers say they try to have the kids visit with their parents as much as possible.
Make sure that, they know that mom and dad are trying really hard and that mom and dad love them a lot.
Patterson says the addiction cycle she sees is hard to break out of. And the worst case is when the cycle comes full circle.
I do unfortunately see some of my children that were children once have become parents and also are struggling with the same issue.
And best case, parents find employment, housing, and freedom from their addiction.
Learning more about what makes an addict tick, the research that suggests people addicted to drugs only see days ahead, not years, when it comes to thinking about their future.
If you or someone you know needs help with addiction, Carillion Connect assessment specialists are taking your calls until 11 p.m. Just use the number you see there on your screen. If you don't get through the first time, please keep calling.
Mental Health First Aid is an 8-hour course that equips everyday people with the skills that they need to assist their friends and family in a time of mental crisis or substance use crisis. The idea is that everyone can be equipped with these skills and really effectively use them to assist someone that they care about. The 5-step action plan that is taught in Mental Health First Aid is assess for risk or harm, listen non-judgmentally, give reassurance, encourage self-help and strategies, and encourage appropriate professional resources. So we know that 1 in 4 adults suffer from a mental illness or a substance use disorder. And we also know that now more than ever, we know we're in a crisis with opioid use and heroin use in this country. And these skills are something that you can use in your everyday life, because this is the CPR of emotional wellness.
As we continue to dive into the details of the opioid crisis, we want to learn more about addictive behaviors. Right here in our backyard at Virginia Tech Carillion Research Institute, a professor is leading the nation in studying characteristics of those who are addicted to substances. After more than 30 years worth of research, he describes the opioid epidemic as the perfect storm. Dr. Warren Bickel doesn't sit in a lab analyzing beakers and test tubes for a living. His research is much more subjective. The decision-making process of addicts.
Certainly, many of us who are involved in this field see the crisis.
After years of studying people who are dependent on cigarettes, alcohol, and other illegal drugs, Dr. Bickel says opioid addiction has triggered a nationwide crisis. Is this worse than what we have seen before?
Absolutely. In terms of the mortality, absolutely. In terms of the number of people showing up in the emergency room, absolutely. In terms of the potency of the drugs that are being used by people on the street, absolutely.
Dr. Bickel says 142 Americans a day are dying from overdose.
More people died in 2016 from overdose than the sum total of all the Americans who died in the 20 years of the Vietnam War. That is startling.
He's citing data analyzed by the New York Times that finds between 59 and 65,000 people died from drug overdoses last year, while 58,000 died over 2 decades of war in Vietnam.
I find it very challenging to think that 142 people a day, Americans, right, are dying. We get concerned when any of our troops get hurt. Well, I think we should think about that in the same way that we think about our own citizens.
Dr. Bickel says his research shows how you see your future plays a role in addiction. He calls your outlook on life future time perspective. His research has found the average person thinks of their future in terms of about the next 5 years. But addicts on average only think of the next 9 days. This concept of short-term focus sparked his interest after a conversation decades ago with a man excited to try a deadly batch of heroin.
He said, haven't you been reading the paper? There's such pure heroin on the streets of Baltimore that people are overdosing. I had to try some. Right, so when I heard that, I said, unbelievable.
Right.
This is unbelievable. And I said, if I could understand, because it's not like there's a lack of knowledge, right?
The question remains, what comes first? Does an addict begin thinking of their future beyond 9 days and then quit drugs? Or do they get clean before starting to think long term? Dr. Bickle says his research is a step in answering the question and could soon lead to better treatment practices. When asked how to solve this growing problem, he says we're not going to arrest our way out of it. And the first step, among many, is adding more treatment facilities.
Part of our challenge now is if somebody wanted to get treatment, often they have to go on a waiting list for weeks, if not months.
Treatment, he says, needs to be as certain as their next high.
The reason that people get trapped by drugs, right, is when you experience them, they're brief, they're intense, and they are reliable, right? You can go to them anytime, day or night, they're going to do what they do, right?
Dr. Bickle and his team live to understand the why behind addiction. So as a nation, we can work on the how to fight it. Dr. Bickle created a registry for those overcoming addiction. And if you would like a link to the Quit and Recovery website, log on to WSLS.com.
Robert Bogues was one of those guys that supplies the people you love with pills, pot, and powder that destroys their lives. He was a big-time drug dealer.
Tonight, Bogues is sharing his story in hopes of helping families steer clear of addictive drugs.
And I've seen more kids die from this. They end up buying it on the street somewhere. Now they're paying $500 a week for their Vicodin supply or whatever, OxyContin, whatever it is, and somebody says, hey, you could save that money if you just do this amount of heroin. And then lo and behold, they get a hold of some carfentanil, dead.
Robert Bogues obliterated much of his life and the lives of so many others with drugs. First by using them and then by selling them. Lesson number 1, pay attention to the early signs and put a stop to it.
The kids are always going to start working with what's out of mom and dad's medicine chest or what they can get online.
Sober now 5 years, he's sharing his story in hopes of making up for his past mistakes by trying to help save lives. This former drug dealer who faced addiction, prison, homelessness, and almost daily danger on the streets selling addictive drugs, now reduced to tears when talking about his face-to-face meeting with parents of drug-addicted children.
Each parent introduced themselves and how they had lost their kids to drugs. And it's the first time I've ever sat in front of parents like that just didn't know what to do.
What he did was tell them the truth.
Do they want to hear that I'm sorry because I represent the drug dealer that sold them the drugs at that point? But more than anything, I wanted them to understand the reality and the truth about addiction, that their kids weren't themselves.
Robert says he was not that different from other kids growing up. He was looking to be popular in high school. Academics and athletics didn't deliver prestige. Selling pot did.
It was the power.
The popularity?
Yeah, it was the popularity. I was the guy. I had the joints out in the parking lot. And that was probably coincides with the actual paying for my own pot. I think it was more the power.
He was using drugs to pay for his own. It's how he and most dealers get started. Then you blink and suddenly you've progressed into a big-time dealer. Cocaine, heroin, crystal meth, he has seen and sold it all and has nothing to show for it.
I don't know anybody that came out of it with everything. I don't know anybody, either you're going to jails, institutions, and death is what we say, but I don't know any drug dealer that didn't end up doing time, that had his money packed away. Sooner or later, the law catches up with everybody.
Telling me he has never seen anything quite like the grip prescription pills has on our communities.
I don't know how many people I know that are hooked on Adderall, but they believe because it's prescribed that it's okay.
Insisting big-time dealers and drug gangs don't have to bother selling pills. The pharmaceutical companies have flooded America with enough pills to create an unlimited supply of addicts.
Those pharmaceutical companies can buy out our own government and allow them to knowingly produce narcotics that they know are going to get the people hooked.
Once hooked on painkillers, Robert says it's easy to convince someone heroin is cheaper and stronger, saying parents need to pay attention, primarily to your kids' smartphones. Kids can and do buy drugs right from the cell phone.
You're the kid, I'm the parent, you're not going to have a phone, you're not going to be on the internet, you're not going to access to all this.
Moving on, as society cracks down on this growing opioid epidemic, it can have an unintended consequence for the people who actually need opioids and have to plead their case in order to get the drugs. Chris Getty of Salem was born with cerebral palsy, and she suffers from numerous other complications like PTSD and being bipolar. She takes fentanyl and morphine daily for her pain, and she tells me that she is addicted despite her efforts to keep the drugs at arm's length. Yet she has found that she has to keep proving her need to doctors who are facing increasing scrutiny.
The pharmaceutical company needs to be held accountable, not just by getting doctors and saying, you're only allowed to prescribe 221 opiate prescriptions, Dr. X, which I did read, I was going to pull it up for you, is a new requirement. Each physician can prescribe so many. Well, if I happen to be 221 and you can only prescribe 220, then you as a doctor are searching your cases to see who really needs them. Well, there are some doctors that need to be stopped if they're over-prescribing. But there are many that are appropriately prescribing.
And Chris tells me that when her pain is less, she often takes fewer pills than prescribed, only then to be told by a nurse that she needs to be careful because people might accuse her of holding the drugs back in order to sell the extras.
Members of law enforcement are working hard to keep drugs out of our area. Why an undercover detective says they're falling behind, saying the situation is, quote, out of control.
And if you or someone you know needs help with an addiction, Carilion Connect assessment specialists are still standing by to answer your phone calls.
A Revive kit is a kit that you'll be using to render help to somebody who is found not breathing related to the overdose of opiates. This is what they look like, and they will have in them certain devices, you know, CPR shields, gloves, and etc., tags, that people can use when they're in the process of reviving, again, hence the name, a patient that, or an individual that has overdosed on opiates. All patients or individuals in the community, I would encourage, if they know someone who is taking opiates, it's not just about the patients themselves, it's about family members, neighbors, community. Having these kits available in the community can save a life.
Police departments in our area are trying to stop drugs from coming in and help users get treatment.
WSLS 10's Tommy Lopez spoke with an undercover officer covering the Roanoke Valley who talks to users every day and says there aren't any clear solutions.
Sergeant Andrew Ashby is a Roanoke Police Department detective on a regional drug unit. He works undercover, so we're not showing his face. He says police are behind in trying to solve the problem.
We're trying to catch up, but it's just, they call it an epidemic for a reason. I mean, it's out of control.
It's out of control in Roanoke, just as much or more than most other areas of the country, according to Ashby.
It's a major problem here. We deal with it every day, every single day.
He sees how it hits people from all walks of life.
We're talking rich, poor, black, white, it doesn't matter. I mean, I talk to heroin addicts on a daily basis, and it would blow your mind, the people that you deal with.
His main goal is to catch high-level dealers and stop the flow coming into the valley.
There's so many dealers out there that when we take one off, another one shows up in their place.
Ashby says it can be hard to get users to give up their drug dealers because they rely on them for their addiction. He says every 3 to 4 months, he and his team take out major players in the drug dealing game. And he says it might not be as difficult as some people would think to sell drugs here.
It's so easy to bring it into the valley, and it's so easy to find it, to purchase it in the valley.
He says police cannot solve the problem just by arresting users.
We could go take them off all day and put them in jail and overload the jail, but we can't stop them from using drugs.
And if they use it one time, they can be.
They use it one time, that's it. You know, there's no going back.
He says his team is putting a lot of effort into prevention, including speaking in schools.
Is this generation of kids that are in elementary school and middle school right now going to grow up knowing more about the dangers than we do?
I think absolutely. I think that's one place that we are winning in. And it might take a couple years for this thing to show up, you know, but I think as police, we're doing a great job of getting out and talking to students.
He says parents need to get involved and help their kids understand the dangers. In Roanoke, Tommy Lopez, WSLS 10.
A first-of-its-kind program in Roanoke is catching the attention of the entire Commonwealth. The Hope Initiative just marked its first anniversary. The nonprofit is step one for those looking to get clean or families searching for answers. The Hope Initiative has made the back room of the Bradley Free Clinic its home. It's an unassuming space with the goal of making people feel like they could be sitting in someone's living room. But the most welcoming part of taking the first step toward overcoming an opioid addiction is the volunteer staff.
We've even had some of our volunteers bring in clothes from home on a moment's notice for someone who had nothing. So that's the kind of people we have volunteering here.
The Hope Initiative was the brainchild of the Roanoke City Police Department, but it survives on volunteers. Here's how it works. If you can't make it to a drop-in Monday, you or a family member can call the hotline for help. Someone like Jamie Waldrop or Marty Turner will meet you at the clinic, and then these volunteers suggest a treatment plan.
Hope volunteer, how can I help you? It's a very cloudy time. It's hard for people to sort out their thoughts, and we have it here. We are trained, we have a list of facilities we're familiar with. We talk to folks all the time in those facilities.
It's as clear-cut as that. They meet with people and suggest treatment plans. But this simple initiative is gaining a lot of attention across the Commonwealth.
I've had calls from Fredericksburg, Madison County, people who have judges court ordering them to come to us to recommend programs for them.
At this point, the Hope Initiative needs more volunteers as opioid abuse numbers continue to worsen.
We haven't even scratched the surface. It's huge.
It's way more than I expected. It's way more than I never expected to be called in here several times a week. Sometimes this place is so busy on a drop-in Monday that you don't know whether you're coming or going.
People come in with a problem and leave with a personal recovery plan. If you're interested in reaching out to the Hope Initiative, you can call the Hope line at 540-339-9010.
This next segment may be tough for parents to watch. A daughter in too deep in the world of drugs. Her mom desperately fighting nearly a decade to get her clean. Tonight, unfortunately, it's no longer about prevention, but preparing for her child's next bad batch. Reporter Nadine Yanes shares her story.
I just ripped her out. We laid her here, she flatlined.
Her lips blue as ice, her breath silent, and her pulse gone. A 23-year-old woman we'll call Susie was dead until a deputy brought her back to life in a movie-like moment.
Well, I don't know if anybody's seen the movie Pulp Fiction, but it was pretty much like that.
Showing the life-saving efforts of the overdose reversal drug naloxone, also known as Narcan.
I knew I had the tools to help this person, and I didn't have to watch someone perish.
It was a moment Susie's mom is thankful for today.
Narcan saved her life.
Knowing her daughter has overdosed before, but never seeing it for herself.
When you saw her OD and then be brought back to Narcan, what was your reaction to that?
And it was startling, and it was numbing, and it was scary, especially when she sat right up.
But it wasn't the first time, and it wouldn't be the last.
Will you accept treatment?
Yes.
It's a battle this mother has struggled with Susie for nearly a decade. In 2012, she went on Anderson Cooper's talk show with Susie and her sister trying even then to break their addictions.
What's it like for you to hear that?
I'm elated, and I really hope that they grab hold.
But Susie never followed through with rehab and is still addicted to heroin today. Cooper even says 8 days after this overdose, Susie OD'd again, and once again, Narcan saved her life.
She wants to do good, and she wants to be an active member of society. She just wants to be normal, and there's always this monkey on her back.
But there are critics out there who say Narcan is not a savior. Instead, it's an enabler. These are just some of the comments posted on social media after Susie's overdose. Let her overdose. We should not be spending taxpayer money and resources reviving these people. Only problem is, she'll do it again tomorrow. We took these comments to the director of Sunrise Detox Center, Dennis Kaleda.
I'd say it's just a little ignorance.
Kaleda says addiction equals disease.
When you're waking up every day and you need something to function, that's an addiction and it's a disease.
Adding these addicts need help.
So no matter if there's Narcan available or not, they're going to push the limits of it because that's what their disease tells them that they need to do. If your son or daughter overdosed, would you want them to have something easily accessible to bring them back to life, or would you just want them to die?
For this mom, the answer is no. She now has Narcan at home for her daughter.
You just try to have a glimmer of hope, but it's diminishing. It's up to her.
No one administers more Narcan than first responders. At times, Roanoke City Fire EMS are answering upwards of 5 overdose calls in one shift. Here's how the numbers break down. At this point in 2016, first responders administered Narcan 130 times. So far this year, they've administered the drug 348 times. That's a 167% increase. We talked to Roanoke City paramedics about what they're seeing on the front lines every day now. Those on the front line say overdoses are happening every day of the week at all hours of the day.
We're finding them at McDonald's parking lot, in the Dairy Queen parking lot, in the grocery store parking lot.
I've run calls where somebody got up and excused themselves, went to the bathroom, came back, sat down, and then the drug kicked in, and in the middle of a meal, they passed out.
Here's how it works. Once the heroin high hits, breathing slows to a pace that causes the user to possibly go into cardiac arrest. Medics clear the airway and work to get the heart going again. To help keep the scene under control, Roanoke City EMS has chosen to use low doses of the antidote, Narcan.
Suddenly you give them a medicine that slams them right back to reality. They come up mad, they come up sick, they can come up and vomit, they can come up and fight because they're disoriented, they don't know where they are, what's going on.
And we try to give a very minimal amount of Narcan. If we can start somebody breathing again on their own without pushing them over the threshold into the withdrawal symptoms, and even keep them where they are still feeling the euphoria of whatever drug they use, then we find them more compliant and cooperative.
So the Narcan is diluted and just enough is given to get the patient breathing again. It can be a near-death experience, an experience some in Roanoke have more than once.
We do see a lot of repeat patients. I think the fact that someone has had a near-death experience and been treated for a narcotic overdose and a respiratory arrest is not enough to break the addiction cycle for a lot of people.
Until the cycle is broken, saving lives will fall in the hands of first responders.
And our phone lines are still open. Experts from Carilion Connect are taking your calls with questions or services related to opioid addiction that you may need or have.
WSLS 10's Rachel Lucas has been in the phone bank all night and joins us now live. So Rachel, education about addiction as well as treatment is what we want to give our viewers tonight.
Absolutely, and that's what our assessment specialists have been doing here in our phone bank tonight. We're really hoping to help start a conversation with our families at home who are watching this, and here to help get that conversation started, I'm joined now by Dr. Burton. He's the chair of emergency medicine at Carilion Clinic. Thank you so much for partnering with us and being here tonight. And you know, what I really want to ask you is, why has opioid addiction really become such a crisis?
It's really at a crisis level because of the size of the problem.
It is really no longer about the old stereotypes of this small problem. It's a massive problem that cuts across socioeconomic boundaries, all ages, genders, race, and so it's become a major scaled size, so much so that now that in both the Commonwealth of Virginia and also in the United States last year, there were more deaths from opioid overdoses than there were motor vehicle crashes.
Wow, and that's just a staggering statistic, and we're going to talk a little bit more about that a little later in the special. But one thing we've had a lot of questions about, just because you were prescribed an opioid, should you stop taking it?
You really want to work with your doctor towards what's the best plan for you. Opioids, for the most people, is not a good strategy for a long-term treatment of chronic pain. And we're really changing our position on that over the last couple of years. 10, 20 years ago, we thought that was the right thing to do, and now we realize it's really not at all. It leads ultimately to long-time addiction. So really, patients need to have a discussion with their physician. They shouldn't just stop their medications immediately. They need to talk with their physician. What are alternate strategies and other plans they could pursue for the treatment of their pain?
All right, that's great advice there. And of course, we'll have more resources posted online, WSLS.com/addiction. If you haven't called in yet, please continue to call in. Our assessment specialist will be taking your calls until 11. I'll send it back to you, John and Lindsay.
Thank you, Rachel. The tragic killer that's causing so many Americans to drop dead is helping others to live. The alarming number of organ donors who have died from drug overdoses.
But first, Carillion Connect assessment specialists are still on hand for about another 10 minutes to answer your calls.
It's very important to educate the community about the dangers of opioids and how addictive they are. It's very important that we're getting unused and unwanted prescriptions off the streets, and drug take-back events are one way to do that. Drug take-back days are a way for the community to be able to come to a convenient parking lot location in the Roanoke Valley and dispose of their unused and unwanted prescription medications safely.
This big blue box is our MedSafe. It's a secured device that we utilize as a drug take-back. And this here, they just bring in and drop them in, and it's taken care of. So everybody can do their part by disposing of the controlleds and other prescriptions in a controlled environment. You can bring in your prescriptions and leftover medications anytime that we're open and dispose of them in the container.
So many people across the country are dying from opioid overdoses that organ donations are actually at a record high.
Drug overdoses are now one of the leading causes of death in organ donors, especially among young people.
WSLS 10's Rachel Lucas went to the United Network for Organ Sharing headquarters in Richmond and found in the past decade alone, organ donors who have died from drug overdoses have increased by 500%.
Here in Richmond at the headquarters of UNOS, death is simply a part of living. Through the work done here, from tragedy also comes the gift of life.
This is a blessing for them, but clearly it comes as the result of a tragedy for somebody else.
The tragic killer that's now claiming more lives than ever before is overdosing, especially on opioids.
I think it's something that surprises a lot of people. Because clearly people think of organ donation and typically they think of traumatic accidents, but now drug overdose is a big part of the organ donation process.
According to data collected from UNOS, here in Virginia, overdosing is ranked as the third most prominent cause of death among organ donors. This year alone, they make up 12.8% of causes of death among donors. That number has increased dramatically over the past decade.
In terms of causes of death for organ donation, it's now larger than automobile accidents.
A statistic that Dr. Klassen, the chief medical officer at UNOS, says is unprecedented growth.
It's a 500% increase compared to 10 years ago.
500%, that's huge.
It's huge.
A trend they really started to notice 4 years ago. Klassen said it started in New England, spread through Appalachia, then to the upper Midwest, now claiming the lives of those all across the country. Just outside UNOS is a National Donor Memorial, lined with yellow roses, the official flower of a donor. Putting a face to that statistic, here we are reminded that those numbers are people, family, friends. These names engraved on the wall represent the thousands who, in death, allow someone else to live. It puts a changed perspective on donation. And here in the memorial, this is what's known as the Grove. For every drop that comes from this fountain, that's meant to represent the life-saving gift of organ donation. And we now know that more young people are giving their organs, not because of a traumatic incident, but because they essentially are taking their own lives due to accidental overdoses. I think anytime there's almost a bittersweet that goes with organ donation.
Well, that's actually true under all circumstances, but I think it's especially, notable under the situation of an overdose death of a young person.
Because of the opioid crisis, it's the first time in recorded history that there's a surplus of young organ donors. Despite overdosing, Klassen says their organs are still quite viable.
A lot of people don't understand that people dying of overdoses can become donors. And in fact, they are very good and appropriate donors in many respects. They tend to be younger, and they tend actually not to have a lot of other illnesses associated with them, such as diabetes or heart disease, because they are a younger group of people as a general rule.
I think that's interesting. There's a stigma that follows addiction in life and in death.
Yeah, unfortunately that's true. Donation under these circumstances has a bit of a stigma attached to it because of the possibility of disease transmission, although very, very low. And I think dying from an overdose there is some stigma attached to that. So I think one of our goals is to try to get awareness out that, in fact, these donors are really appropriate and can be used very, very successfully and can prolong somebody's life or save somebody's life.
Safety remains a priority. All organs are inspected by doctors before being given to another person. Klassen says the risk of viral transmission is less than 0.1%. Through a tragic epidemic sweeping the country, killing tens of thousands each year, others are ironically being saved. For many families, that gift of life comes as the only comfort after losing someone to addiction.
It is clearly a sad, it's a very tragic situation for a lot of families, for the entire country. But I think if we look at it as, kind of getting a little bit of good out of what is clearly a bad situation.
While there's no question the good a selfless act like becoming an organ donor can bring to others, many are facing that reality at a much younger age than needed to, meaning that the rise in available organs to those in need is sadly only a silver lining in a much larger and growing epidemic.
Let's take one last check-in of our phone bank right now with Rachel Lucas.
Rachel, looks like we've been able to help a lot of people tonight.
We have, and that's really been the goal, is to reach out to any of our viewers who have been struggling, who have questions, to give them a resource, and our viewers have certainly reached out. As you can see, the phones have just been ringing off the hook since we opened this phone bank, and I think it's important to let our viewers know that they are not alone. These phone banks will be open for just a few minutes, but if you weren't able to get through tonight, we have launched a new part of our website, WSLS.com/addiction. There you will find all the resources you need as you continue to reach out for support. For now, I'll send things back to you, John and Lindsay.
Thank you, Rachel, and volunteers. Over the last hour, we've talked about everything from how we've gotten to this point to the options out there for treatment.
If you or someone you know is addicted to opioids, you're not alone. Please reach out and ask for help. We've posted all the stories and information from this special on our website, WSLS.com/addiction.
And we thank you for joining us for Opioid Nation and American Epidemic. Have a great night.